I will skip the first part. This is the figure model. First display was raised at the molar site of the pig. Okay, now it's time to release the play. Find the rather thick area of gingiva. Then using a number 15 blade, make the shortcut. Deposit indentation should be formed. Then scissor is inserted through the exposed portion and advance the forward direction. Then flap is released, periosteum is clean, not damaged, blood vessel is not cut severely. Okay? Okay, go back to the slide. In my experience, this technique is very effective in maxillary anterior area or scar tissue area. In maxillary buccal anterior side, where teeth were extracted a long time ago, bony concavity with strong muscle insertion, which is always, right? So if you do not use the blade carefully, perforation of tissue at the undercut area may occur. The scissors technique can be a more appropriate technique when severe bony undercut exists. And visibility and accessibility is good in anterior side. You can apply this technique in this site. To regenerate the lost buccal bone tissue of this patient, I used the allogenic bone graft for space-making device. I fixed this allogenic bone graft at the most severely resolved site as a clamp. Then I applied sufficient amount of bone graft, particulated bone, osteon 3, mixed with allograft material, the remaining part. Then I applied genus carbon collagen membrane, 3 pieces of collagen membrane was applied, one large size, 15 by 20 millimeter size implant was placed, and whole wound site was stabilized with membrane holding suture technique. I will show how I could achieve the primary flap closure with the sharp end seizure. I cut the periosteum 3 times at different sites. You can see the 1, 2, 3 incision line here. This is CT image after 6 months. This is showing the successful augmentation outcome. Now it's time to place implant. After flap or blazing, the intact collagen membrane was found. Underneath the newborn tissue was found. Successfully augmented bone is observed. In aesthetically sensitive area, a tiny miss implant positioning would lead to poor aesthetic outcome. So once implants were placed alone, aesthetics would not be achieved by any prosthetic compensation. So in this case, I utilized the surgical guide system, and 5 implants were placed in proper position. Without this implant, primary stability was achieved sufficiently, so immediate provisional restoration was provided to the patient. This is 2017. At the time, I bought Dentium CAD-CAM system first. So I only test that system. I